We mentioned we had an important health news story tonight. This one's enough to shake your faith in any treatment. It also may be called the cost of good intentions. The story is this. As we said, you might call it the cost of good intentions because women who take Lipitor or the other statin drugs for cholesterol have approaching a 50% greater chance of developing diabetes, according to this study. And it's a story that affects potentially millions of Americans. We get our report tonight from our chief science correspondent, Robert Bazell.
Tens of millions of Americans take medications called statins. Zocor, Lipitor, and Crestor are the most popular in that class that cut cholesterol to reduce the risk of heart disease and stroke. But new evidence suggests these drugs, often called wonder drugs, may also be a risk factor for type 2 diabetes.
The study out today from the government's Women's Health Initiative followed more than 150,000 women over 50 with and without heart disease for about 10 years. It found that those taking statin drugs had a 48% greater chance of developing type 2 diabetes.
Judy Barrick has her diabetes well under control, but she was not surprised when she was diagnosed 19 years ago. Diabetes ran in her family, and her weight was way too high.
I was sort of a perfect candidate.
But today's study suggests the statins she was taking may also have put her at risk. Doctors don't know why statins increase diabetes risk, but today's findings are in line with previous smaller studies. The research does not implicate any single brand.
This association was true of both the low potency and higher potency statins and appeared even with shorter term use as well as with longer term use.
These are so widely prescribed.
Specialists like Dr. Robin Golan emphasize that since heart disease is one of the major complications of diabetes, no one should stop taking their medication, but the risk is something to consider.
Doctors will have to factor that into the equation and think about it, especially in lower risk, lower weight women who are being started on it for prevention rather than for treatment. Need refills.
Judy Barrick has no plans to stop taking her statin.
I have to weigh the risks and talk with my doctor.
Good advice for all patients, and another reminder that every drug has both risks and benefits. Robert Bazell, NBC News, New York.